3 things I like about being a certified nursing assistant. Who are you to refer to us as only a CNA? We're the ones who wash and dress our patients for the day. We're the ones who take the time to listen to them speak. We listen to their life in a 40-hour week. Choosing to be a CNA is demanding, but very rewarding and humbling. I am compassionate about my job and about trying to listen to my patients as well as make them happy. Compassion is mandatory. Your patients rely on you for help with daily activities and hygiene. Daily activities like brushing their hair or their teeth, and hygiene like making sure that you're bathing them and that they are clean and look good for the day. One must be compassionate during care. For example, while helping a patient bathe, your patient may be in pain, so help where needed and be careful to not hurt them any further. The patient depends on you, so be compassionate to their needs. For example, they can't help that they ring so often to go to the restroom. Medication can be a cause of this. They know that you are busy, but nature calls. When working with a patient, treat them as if they were a family member or a close friend. Be kind and be patient. You should never try to hurry a patient. If you try to hurry the patient, they may fall or become so upset that they get aggressive. Think about it. Do you like to be hurried when you're getting ready or whenever you're going to the restroom? Along with being a compassionate caregiver, I love listening to stories from my patients about their lives. Truly listening to someone's life is pretty amazing. You get to hear about the good, the bad, and the humorous. Everyone needs someone to listen to them because communication gives life meaning. For example, the CNA on shift comes to get you ready and take you to supper. You find out that it's fish, and you hate fish, or you could possibly be allergic to fish. You can then at least relay that information to the CNA, and you can tell them that you don't want the fish or that you can't have it, and you can get an alternative meal. If you couldn't communicate this, you would end up being very hungry, or possibly even dead. Some patients wish to pass on their knowledge or their history. Some patients simply want to engage in a conversation and smile. I love learning who my patients are as a person and making them smile. Along with listening, sometimes the patients just need to smile. In this job, I have learned that when your patients smile, this causes a release of endorphins that lower heart rate and blood pressure, and it makes them feel good. This feeling good feeling is from chemicals that are released into the system. They are dopamine and serotonin. The patient starts to relax and then feel happy. Smiling is like medicine, so to speak. I love looking at someone and knowing that I am the reason that they are healthier and happier. I know that this is a lot of information, so let me summarize the main points again. In conclusion, compassion is required to do this job because patients rely on you for so many things. Listening and learning who your patients are and what their needs may be will be very helpful to you. The patients need someone to listen to them, engage them in a conversation, and make them smile. After all, what if it was you in that situation? Wouldn't you want to be happy and comfortable?